When you come to EASD, one of the things that is incredibly impressive is the enormous range of devices that are available to patients and indeed to practitioners. In fact, there are so many now, there are so many apps that actually the situation is quite confusing. So we have the perfect person to help explain where this is all going. And that's Pratik Choudhary from King's College in London, a diabetologist with a particular interest in technology. So help us out of this mess. Explain some of the confusion. Where are we going and what are the big trends?
So I think you're right. There's a lot of different devices coming through, and predominantly the focus is on type 1 diabetes. And I guess you could probably bunch those devices into three main categories. We have the insulin pumps, and there's some interesting, hopefully, announcements to be made and some new entrants to the market coming through. So I think a lot of people attending the EASD this year will be interested to look at those new insulin pumps and see what they offer over and above current products. There's, of course, the continuous glucose monitoring side of things, and there are some interesting announcements coming from big industry players at this meeting as well, looking at how people can monitor their glucose in a simpler and easier manner and make the most of that data. And then there's this third bit, which you mentioned, the kind of apps and the big data and the kind of decision support stuff. And that stuff is still maybe one step away from real use. And so that is a bit which is kind of looking ahead into the future and seeing where people are. And so, sometimes we divide those things up into what we call proximal technologies, things that attach to the people, and then distal technologies which help them in their interaction with their healthcare team or their carers. Yeah.
And interesting because actually with some of the devices that we've now got, the wearables, the range of information and data that you're getting from patients is actually very high quality. I mean, in the past, you didn't really trust some of patients' data, because they would take it themselves and it might not be that accurate. But now it really is accurate. And actually that data, that additional data, may give us some really important clues as to, what to do best for patients.
Absolutely. And I think, the medical profession, if I may say so, is kind of struggling to catch up with what to do with all this data. And so there is a theme underneath there that is interesting to look at in the CGM sessions, in the pump sessions, to see, in your 15 or 20-minute consultation, how do you look at reams of data that might stretch back, readings done every 5 minutes over the last 3 months? And how do you deal with that data? What do they tell us? How our language of talking to patients is changing as we introduce these technologies into the clinical sphere. And you're absolutely right. There is no place now for patients to hide, in a sense. The data's there, and so you can make far more meaningful and effective decisions around education, around changes in treatment, hopefully making life with diabetes that little bit easier.
We can't have a discussion about technology without mentioning AI. So you mentioned the huge amounts of big data. AI is there. The algorithms are ready. How important is AI going to be in diabetes?
So I think the AI, we're just now starting to get the wearable tech and get the monitoring going. And actually for the AI, you need to get high quality data into the AI. So I think now, for example, certainly in Western Europe, the advent in type 1 diabetes of more continuous glucose monitoring, which has really taken off. We need to get some information from the people using injections, using pens that communicate into meters and can communicate up. So there's a little bit of infrastructure that still needs to happen before we really take advantage of AI. But there's a session on Friday morning that I'm really looking forward to that's going to open the door a little bit to kind of the big data and what we can learn from that and how that can actually, there's going to be a lot of trickle-down effect as well. So you might have that tip of the iceberg who are using closed-loop data, making their own artificial pancreases, and what they're doing is feeding down into routine clinical practice. There's a lot of trickle down for people who might not have access to those technologies as well.
But very important that we have open access algorithms. In other words, we don't have algorithms which are black boxes, because one of the things that we do know is the potential for bias in algorithms.
And AI by its nature sometimes will be a bit of a black box. It will make decisions and it will learn and it will be self-learning. So as things come on, I think the key aspect is that they are tested in a safe environment. And my bias, talking about biases, is that decisions made by the systems are probably going to be safer than decisions made by people, which are influenced by how they feel at any given time. A machine is supposedly emotionless and makes data-based decisions. So as long as you feed the right data to the machine, my hypothesis or the bias from people like myself who are a bit enthusiastic about technology is those decisions overall work a little bit better for the patient.
Anything else that takes your interest, particularly at this Congress?
So I think, there's a couple of CGM sessions that are looking good. There was an announcement by some companies about some new technology coming through, and it's good to, in the symposia here, we have the opportunity to go and see and touch and feel and have a look at those products and see how they work. As I said, I think for me, big data, looking forward 5 years and seeing where things are going, trying to be at the cutting edge. That's always the fantastic thing about the EASD. It's always at the cutting edge. You've always got the latest stuff here, and you're always learning something new wherever you are in your kind of journey of diabetes.
Okay, so I'm going to put him on the spot. So I have to tell you that I used to host a program for the BBC in which we made predictions about the future, and I'm telling you this because none of the predictions I made proved to be right in the end. But I'm going to pin you down and say, in 10 years' time, give us a prediction about technology. How will we be using it?
So I think the most exciting technology, I haven't quite mentioned it, is closed-loop technology for type 1 diabetes.
And there's a big announcement about that.
And there is a big announcement about that, and the first commercial system, which was launched in the US, is probably going to come here, and there may be other announcements. I don't know if you're alluding to some other stuff. I think that will be a game changer because our current module is, or methodology is, we teach the patient to do certain maths and certain calculation. We give them tools, pens, pumps, syringes, and actually the workload of what they have to do every minute of the day, we've increased that incrementally since the 70s and 80s. And if you listen to qualitative work done from people using closed-loop systems, certainly systems like DIY home loop systems, their lives are completely transformed. The community came back with a number that they spend 1 hour per day less working about their diabetes to maintain control. And they're getting control that we can't dream of achieving with our conventional ways. If people were to access this, and if we can afford to give people these systems, we will abolish pretty much blindness, renal disease, and foot amputations in type 1 diabetes. It's a big win to have if we can make it happen.
Fantastic. Well, a great roundup of the technology, and you can see all of this stuff, or at least have a look at the papers and hear the presentations through EASD.org.